As many as 9 in 10 adults do not know they have chronic kidney disease. Don't be the 9, be the 1. The kidneys are small organs that filter all the blood in the body every 30 minutes. They remove waste, toxins, and excess fluid. Additionally, they help regulate blood pressure, stimulate the production of red blood cells, keep bones healthy, and regulate blood chemicals that are essential to life. Chronic kidney disease is associated with a higher risk of cardiovascular disease, end-stage kidney disease, and mortality. Chronic kidney disease is defined by at least 3 months of 1. Decreased kidney function, which is measured by glomerular filtration rate, GFR, less than 60. Or 2. The presence of kidney damage, which defined as albuminuria, albumin in the urine. Measured as albumin to creatinine ratio, ACR, abnormally values are 30 and above. Urinary sediment abnormalities minus such as red or white blood cell casts. Imaging abnormalities such as polycystic kidneys, hydronephrosis, and small kidneys. Pathologic abnormalities by biopsy. GFR is calculated based on creatinine value in our blood. See video description for a link to a GFR calculator. The most common causes are poorly controlled diabetes and hypertension. Other causes are glomerulonephritis, polycystic kidney disease, lupus, Alport syndrome, and kidney cancer. Global prevalence is about 15%. Prevalence is higher in females, but males are more likely to start kidney replacement therapy. Chronic kidney disease is more common in Black adults than in white adults. Most have no clinical symptoms, and kidney disease is often detected when an elevated serum creatinine or an abnormal urinalysis is discovered incidentally. In addition, radiographic findings, such as small kidneys or multiple cysts, may be detected on imaging performed for other reasons. Some patients may present with symptoms and signs such as edema or hypertension. Assessment of kidney function is done by estimating the glomerular filtration rate, GFR, from the serum creatinine. Further testing includes urinalysis, which may show proteinuria, hematuria, and cellular casts. Ultrasound may detect abnormalities such as polycystic kidneys, hydronephrosis, and small kidneys. A kidney biopsy generally is not mandatory but may reveal evidence of a specific disease. Other common laboratory abnormalities include anemia. The kidneys produce the hormone erythropoietin, EPO, which tells the body to produce red blood cells. When the kidneys are damaged, there is not enough EPO, which results in anemia. Hyperkalemia, high potassium levels. The kidneys are responsible for excreting most of the potassium that is consumed daily, so when the kidneys are damaged, not enough potassium is excreted. Hypocalcemia, low calcium levels. The kidneys make vitamin D into an active form. Vitamin D is an important factor in maintaining normal calcium levels, so when the kidneys are damaged, they are unable to make enough active vitamin D. Classification is based on the GFR and albuminuria levels. Doctors usually use the heat map. On the left side of the map, a higher GFR number is better. On the top of the map, a lower urine albumin level, ACR, is better. A green box means normal values and no kidney disease. As the colors change from yellow to red, the higher the risk for disease progression. The cause of kidney disease has implications for the rate of progression and the risk of complications. If a patient is staged initially as low risk, this does not mean that he or she will not progress over the next several decades. Complications of kidney dysfunction include disorders of fluid and electrolyte balance, such as volume overload, hyperkalemia, anemia, hypocalcemia, and hypertension. Worth noting that hypertension can be a cause or consequence of kidney disease. Later stages have severe complications such as anorexia, nausea, vomiting, fatigue, and bone disease. There is also an increased risk for drug toxicity, as the kidneys are responsible for many drugs' clearance from the body, so as the kidneys are damaged, they cannot clear appropriately the drugs, which leads to higher than needed drugs levels. Treatment is blood pressure control and blood glucose control. Kidney protective drugs. There are 3 classes of drugs. 1. Angiotensin-converting enzyme, AC, inhibitor, for example benazepril, lotensin, captopril, capitan, enalapril, Vasitec. 2. Angiotensin receptor blocker, ARB, candesartan, Atacan, valsartan, Diovan, losartan, Cozar. 3. Sodium glucose cotransporter 2, SGLT2, inhibitor dapagliflozin, Forxiga, empagliflozin, Jardiance. Protein restriction may slow the progression of the disease. Smoking cessation. Medical management is also required for complications. Severe renal failure may need kidney replacement therapy such as hemodialysis, peritoneal dialysis, or kidney transplantation. Ask your doctor for a kidney function test, a simple blood test to calculate GFR based on creatinine levels, and for a urine test to detect albumin. Want to know more? Watch my channel.